Dr. Nielsen usually requests the custom trays. What we want to do first is line the models with some Vaseline, just so that your wax does not get stuck to it, because that makes it harder for you to try to get it off. So I just use my finger, a real thin layer, kind of paint it on there. And you really only have to paint it where you know the wax and the tray material is going to be. So just kind of rub that on there real lightly. Good to go. We have wax strips like this for the custom trays. I usually just like to take one, fold it in half, because you'll use an upper and the lower, and it'll make it like perfect size for you. When it's nice and cold in here, it breaks really easy, huh, Shy? For these, you'll want to soften them up a little bit. So we'll use plain here, just kind of soften it so that it's a little more pliable. You can work with it a little easier. And then I like to just kind of shape it on here. And I don't get it too warm because then it'll break through, but you can see it'll just really easily. If you start to get a spot that won't, you can just put that back over. If you start to get a spot that melts through, you can thicken it up there. It's really easy to work with. So this one, we'll just kind of do these at the same time. Woo! Okay, fire! That was fun. Sometimes if you have to fill in that space again, it's sometimes the very posterior tooth will kind of break through the wax. That's okay, you can just do a little bit of that. Okay, and then once I have it to where it's pretty much molded around there, this one should fill in there. And the wax doesn't have to be like perfect, but you'll want to make sure it doesn't have a bunch of lumpiness or anything, because then it'll make it more noticeable with your tray. So I just make sure the wax covers the entire gingival surface of the teeth, and then I'll kind of cut it along the edge of where you've trimmed the model. Just kind of go right along the edge here. Same on the posterior. And that's what's nice. Some people that have really tiny mouths, this will just make it that much easier on them. Usually, if they're missing a bunch of teeth, like this patient only has these 2 canines, I'll make some stops in the wax, just so that when you go to get your impression, you can put your tray material down into those stops, and it'll make sure it's seated all the way. And it'll just give that much better of an impression. So I kind of clear out a couple little squares where they're missing teeth. Finish trimming this one. And then you'll want to make sure, obviously, on the lower that you're not making a full arch, that you're doing a horseshoe shape around their tongue. Okay, there's those. And for the tray material, it is a light blue material, so you don't have to work like super quick, but and it's blue now, so it used to be just clear. So it's basically the same concept as the wax. You're just going to place this right over your wax material here. And in those spots that I had the stoppers especially, I'll kind of push it down in there until you can feel it going all the way against the stone model. and you want to make sure you have any air bubbles. So I usually like to start on the upper, kind of at the back, and work my way forward, so if you get any air bubbles, they don't get caught up in the palate. Stuff kind of stinks. Smelly. And then again, you'll just go through and kind of trim off any excess. This stuff, I'll keep the excess and kind of fill in any little spaces I need to. You have to make a handle for them also to give something for the doctor to hold on to. So I'll kind of start a pile. Okay, and then once I've made sure it's all pretty flat and aligned with the wax, we'll grab our little extra here and then through the extra tray. And this, for the handle, you want it to be thick enough that it's not going to droop too much, because it does have to sit and try to cure for about 2 minutes, but you don't want it so thick that the doctor can't really get his fingers around it. So I usually just try to use my own fingers as a reference of pushing this on here, trying to get it shaped to where it doesn't look like just a giant blob, which can be challenging, but get it to stick on there. And then I kind of test my fingers, like, okay, where's that setting? Is it going to be in a spot that's going to be awkward for the doctor? Is it going to be, especially where this patient doesn't really have teeth in the front, it'll kind of see. So I usually start it up a little higher, because you can kind of see it starts to droop. So I like to start it a little bit higher, and then as it sits in there, it'll kind of droop a little. Our machine here, curing machine, goes about 2.5 minutes. And then we will take this out and start, maybe. Okay, so you can hear that it's going. Once this 2.5 minutes is done, I'll take it apart from the model and then let it sit for another 2.5 minutes in there without the model on it. So we want a full 5-minute cure, but we'll do the same with this lower here.
The other thing with the handle is Dr. Hume was telling me that if you put it down too low when he pushes it in for their tray, it pulls down their lip and you can't get their vestibule. So that's another good reason to
try to start it up a little higher. Yeah. And it can be hard because you think you're in a good spot and then you take it out of the warmer and it's like drooped a lot. So again, I try to kind of test it and see where it's going to end up and do the best you can with the handle. And any excess I have, even after I've cut this all off and made the handles for the lower, if you have extra, you can just keep it in that box, because we may need it for another one. So I usually don't throw any of this extra material away. I try to keep it and save it for the next one. So again, on the lower, like Jenna's saying, I try to keep it back towards the lingual and then stick it on here so that you're not worried about any of this vestibule part, or where they're, if they have a frenum on the top or lower, that might come into effect also. So and that's usually how I do it. I'll usually put the one in there while I'm working on the other one, and then by the time that's done and ready to go, then this one can go in while I separate that next one, and it should only take you a couple minutes to get that done. But we'll save, I'll go ahead and just kind of stack that together in here, together like that, so that we have some extra into. And then now that that one's done, take it out. Oh, that's still pretty floppy. This material's a little different. But see, I'll take it apart, and now with just the wax in it, I'll set this back inside, and then I'll set this one also in. Still a little pliable, so just kind of be a little bit careful with where you're setting them. Like that, and let it bake.